In January this year, Nigeria's Center for Disease Control and Prevention declared an outbreak of diphtheria in Nigeria, with Kano State recording the most cases. Director General of Kano State Primary Healthcare Management Board, Mahmud, says about 520 children are suspected to have died from diphtheria in the state. In this story, Just Nigeria Zinabala asked experts about the disease, its symptoms, and how Nigeria can prevent the outbreak from becoming a national disaster.
Nigeria seems to be in the throes of a severe health emergency, with diphtheria sweeping across the country. Nigeria Center for Disease Control (NCDC) declared an outbreak of the disease on January 20th, 2023. It's a crisis that's caught the world's attention, with International Medical Humanitarian Organization Médecins Sans Frontières, or Doctors Without Borders, issuing a chilling warning that underscores the gravity of the situation.
Women and children under 5 are the most vulnerable group.
Adding to the grim narrative, the United Nations Children's Fund, UNICEF, has brought to light alarming statistics that paint a stark picture of the dire circumstances at hand.
Nigeria is experiencing one of the worst outbreaks of diphtheria, and the epicenter of this diphtheria is in Kano State.
According to UNICEF, Kano State in northwestern Nigeria is at the heart of this unfolding crisis, bearing the brunt with a staggering 80% of Nigeria's diphtheria burden. It's here that Just Nigeria meets Mariam Shoaibu, a resident of Dakatahadeja Road in Kano City, who suffered the devastating loss of her 6-year-old daughter to diphtheria.
Kuma sai ta tashi da zazzabin amma wuyanta ba ta tsayar da shi, sai dai tana miƙar da shi haka. Kuma shine kuma ta cikin hancinta ma kuma sai jini ya fito haka. To daga haka dai in ta dan ci abu haka za ta dan amayo da shi kuma za ka ga wannan alamun jini a ciki.
But Mariam is not alone. Just 2 months ago, Hawa Ubalarabe's 1-year-old daughter found herself locked in a battle with diphtheria.
Ta fara dai kwana aka ɗaya biyu sai ta fara tula yawu ba ta iya yawu take da lalan yawu. Tana kuka sai na duba bakinta sai na ga haka wa'ansu farin abu ya fito mata akan harshenta da can wajen makogaranta. Gaskiya na ji ba daɗi dan na kare sosai.
This is Kano State's Diphtheria Treatment Center at Murtala Specialist Hospital, where the battle against this relentless disease unfolds. Jafaruddin Muhammad, a public health physician, is no stranger to the cases that come through these doors.
We have seen various cases. Initially, the first sort started as a very simple, just mild, moderate cases of diphtheria, where patients present to you with just routine fever, membranous patches, occasionally bull necks. And as the course of the disease progressed, we started having cases of patients coming down with complications.
While the Nigeria Center for Disease Control says it recorded 11,587 suspected cases and 453 deaths nationwide, the Director General of Kano State Primary Healthcare Management Board, Mahmud, in a media dialogue, says about 520 children are suspected to have died from diphtheria in the state this year alone.
It is commonly a disease of children because of the level of protection that they have compared to adults.
A diphtheria outbreak first occurred from February to November 2011 in the village of Kimba and its surrounding settlements in Borno State, northeastern Nigeria. Diphtheria, a bacterial infection, is no walk in the park as it targets the nose, throat, and sometimes even the skin. The disease is primarily caused by the bacterium Corynebacterium, with Corynebacterium diphtheriae being the usual culprit. It often starts with symptoms like a sore throat and is known for telltale adherent membrane covering the affected areas. Experts describe diphtheria as a crafty traveler that hops from person to person through direct contact or by hitching a ride in the air via respiratory droplets when someone coughs or sneezes. It can even sneak around on contaminated clothing and objects. If you catch it, you become infectious as long as the bacteria linger in your respiratory secretions, usually up to 2 weeks without treatment, and in rare cases, even longer. Think 6 weeks or more for chronic carriers. The most common type of diphtheria is the respiratory kind. When it strikes, symptoms usually kick in about 2 to 5 days after exposure. Initially, you might just feel like you have a mild cold, fever, runny nose, sore throat, cough, and maybe even red eyes. But in severe cases, the bacteria unleashes an exotoxin that creates a thick grey or white patch in your tonsil or throat bag. This can block your airway, making it tough to breathe or swallow, causing a distinctive barking cough. Your neck might also swell up due to enlarged lymph nodes, giving you what's often called a bull neck appearance. Why does Kano State have the highest diphtheria cases in Nigeria?
This is because of the break that we have experienced in Kano with many zero doses in many of the local government areas.
But beyond Kano, what are the risk factors in other parts of the country?
Data from the ongoing outbreak in the country has actually shown that the most important risk factor for this outbreak is suboptimal vaccination coverage. A significant amount of cases that have been identified have either received no dose at all of this vaccination, or have actually received fewer than the expected 3 doses that they are supposed to receive.
The National Primary Healthcare Development Agency is at the forefront, spearheading Nigeria's federal government's response.
We've moved really rapidly to engage with our partners at the subnational level, especially those states that are in the forefront in terms of the numbers of diphtheria cases. Not only people who are sick treated, but also that there's laboratory confirmation, and that those that are either contacts or people that are in the vulnerable age group get the vaccines that can prevent diphtheria.
Over the past 5 decades, diphtheria cases have significantly declined worldwide thanks to widespread immunization. What can families do to protect themselves from diphtheria?
If you want to cough, make sure you don't cough into another person's nose. So you'll protect yourself, because this disease we are talking about is transmitted through droplets. We need to report early to health workers, and we don't even have to put health workers at risk. We must immunize our children.
The government team should be on ground to ensure that there is a massive awareness for the community to be aware about these signs. And this can go from house-to-house mobilization to community mobilizations, engagement in the radio, to let people know at the health facility, anybody that comes to the facility, there must be sensitized. Whether there is a report of diphtheria or not, as far as there are some cases reported in that particular region.
Experts say that in addition to these efforts, the sobering nationwide mortality rate, especially in Kano State, demands urgent containment of this outbreak and a dire need for comprehensive vaccination across Nigeria. Zainab Bala, GIS Nigeria.
Diphtheria is indeed a health emergency that requires urgent and effective attention from all stakeholders. Do you have a diphtheria story to share? Reach us on X at GIS Nigeria TV. We'd like to hear from you.